What drugs was Rich Piana using? Why was his body left to rot in intensive care for 2 weeks despite being brain dead? Where are his toxicology specimens and reports? Why did his autopsy report declare his death to be undetermined? And how tall was Rich Piana measured at death? Hi, welcome back to the channel where we cover all things interesting. My name is Dr Aziz, I'm a medical doctor based in the UK. In this video, we'll be taking a look at the demise and death of Rich Piana at the young age of only 46. Rich Piana was an American professional bodybuilder, YouTuber and celebrity. He was a charismatic individual with a large following, known also for his candid steroid and substance abuse. In 2017, he suddenly collapsed, going into cardiac arrest, and was finally declared dead 2 weeks after in hospital. So what did actually happen? Why did he suddenly collapse? I've watched the other YouTube analysis, and no offense, but they're pretty clueless, simply stating that there's not much known simply because the autopsy report says undetermined. The devil is in the detail, and trust me, there are plenty of clues and facts in the autopsy report that can tell us what exactly happened. We'll explain what most likely actually happened, whether his substance use had anything to do with his death, and why he actually died outside of hospital in his bathroom as opposed to in the hospital as widely reported. Rich Piana was having a haircut when he suddenly lost consciousness and went into cardiac arrest, i.e. his heart stopped. His girlfriend made some attempts to resuscitate him, and eventually paramedics arrived 15 to 20 minutes later and took over. They were able to get his heart beating again, but there was a clear period of anoxic brain damage, i.e. lack of oxygen getting to the brain. He was taken into hospital where they stabilized him, put him on a life support machine, but to little avail. He never regained consciousness, but curiously was kept on a life support machine until about 2 weeks later, when infection took over his lungs, leading to sepsis, multi-organ failure and death. In all honesty, this is a sequence of events that we see very frequently in the intensive care unit. The truth is, Piana died outside of hospital in his bathroom, and his body was kept on a ventilator for a quite surprising 2 weeks before it completely packed in, and there are certainly some big questions to be asked. So anyway, let's take a look at the autopsy report and a few things to highlight here. First, surprise, cardiomegaly or enlarged heart, 670 grams. The average is approximately 300 grams for a man, so we're talking about twice the size of what it should be, or more than that. Again, almost certainly the consequence of steroid growth hormone and other illegal substance use and abuse. Mild coronary atherosclerosis. This just means mild plaque buildup of the blood vessels supplying the heart. So no myocardial infarction, aka heart attack, which is a complete occlusion of a coronary artery. That did not happen. Number 2 here, bronchopneumonia. This is just the infection that ultimately manifested in the end, something we commonly see in the intensive care unit as mentioned as a body lays dormant. Number 4, brain edema. This means excess fluid, ischemia and necrosis. These mean lack of blood supply and tissue death respectively, which were basically consequences of the cardiac arrest in his house and the delayed CPR. Some of the other things mentioned here and in the report in general, such as discoloration of the skin and sclera, ascites, i.e. fluid in the liver, are simply consequences of being bedridden for 2 weeks and the subsequent sepsis and multi-organ failure prior to officially being declared dead. So I wouldn't read too much into these. Just on this final point, toxicology missing, I'll come back to this shortly. So moving on to page 2 here, it says the body was measured 72 inches in length, which is 6 feet exactly, and weighed 221 pounds. Moving on to the head, it says here slightly decomposing necrotic appearing brain, as mentioned, due to lack of blood supply. Coming on to the heart, this is where we see the gross abnormalities. 670 grams, as we mentioned earlier, and further down here it categorically states heart was enlarged with the myocardium, that is the heart muscle of the left and right ventricle, basically the two major chambers of the heart, hypertrophied, which means enlarged. But again, what we are seeing here, as we have seen with other bodybuilders and wrestlers on this channel, the consequences of using anabolic steroids, growth hormones and other illegal substances which can lead to an enlarged heart. As mentioned, this can be a consequence of steroid use. The heart enlarges, there is subsequently scar tissue, and this enlarged heart puts a person at great risk of an arrhythmia or dysrhythmia, which means an abnormal electrical conduction and sudden cardiac arrest, which is what I believe happened. Remember, there is continual electrical activity in your heart from the moment you are born until the moment you die. Any disruption in this electrical activity, which having an enlarged heart puts you at risk of, can result in sudden cardiac arrest, i.e. death. So what we are seeing here is a clear pattern. Remember, a man's heart should not weigh more than 450 grams. Randy Savage's heart was significantly enlarged at 610 grams. It states here cardiomegaly, which basically means enlarged heart. Cardia, the Greek word for heart. Mega, also from Greek meaning extremely huge. Ultimate Warrior's heart was even larger at 650 grams. And we have mentioned here in British Bulldog's autopsy that his heart was enlarged. And again here in Ziz's medical report, we again see an enlarged heart. Rich Piana's heart cardiomegaly again 670 grams. The paramedic report stated, confirmed even afterwards, that they found Rich Piana in ventricular fibrillation, which is an arrhythmia. So anyway, in conclusion, it's pretty clear Rich Piana had an enlarged heart which led to his sudden cardiac arrest, maybe triggered by something he was taking at the time. They kept him alive for 2 weeks. I'm really perplexed as to why. A head scan would have been done shortly after he was admitted to hospital, which would have demonstrated irreversible brain damage. If this was the UK, he would have been declared dead soon after. Why they kept his body going artificially for another 2 weeks is really odd. Which also ties in with the other odd aspect of this whole scenario. Where is the toxicology report? How can there not be a toxicology report? They lost it? All his substance use and abuse, the drug paraphernalia found at his house, and they weren't able to obtain a toxicology sample? It wasn't as if they found a stone cold dead body. His body was kept going for another 2 weeks. They could and would have taken blood samples throughout his stay in hospital. Go back to page 4. Genitourinary system. Urine was present in the urine drainage bag. He was producing urine right until all the supporting machines were turned off. Yet still no toxicology sample or report. Very, very odd, I have to say. Anyway, what are your thoughts? What do you really think happened with Rich Piana? What are your memories of him? Do post your thoughts down below. A shout out to autopsyfiles.org, awesome website where you'll find plenty of autopsy reports to read through. Anyway, plenty more coming soon on this channel. Make sure to hit the like, subscribe and notifications button. Until next time, stay safe.